Now look at this diagram where we have approached in this posture. Now, if you are looking at this, we have already told you that we have removed from here all the 9 layers, means 3 layers of the fascia, I say skin and the fascia, 3 layers of the muscles, 3 layers of the connective tissue and the peritoneum, and we have removed here even the peritoneal cavity till you reach here to the posterior abdominal wall, which in fact will be having here, right from here skin up to parietal peritoneum were 9 layers. So parietal peritoneum was the ninth layer. But if you are actually looking at your posterior abdominal wall, the parietal peritoneum right from here will be the first layer. And you have removed the parietal peritoneum, you reach actually the 8th layer, but from inside it will be the 2nd layer. This is the extraperitoneal fat, and here the extraperitoneal fat is called the retroperitoneum. You are here in the retroperitoneum, and you are looking at retroperitoneal structures. This is the diagram that reflects here. That means you are seeing here the two kidneys. You see the two kidneys here. You are seeing from the two kidneys are emerging now the two ureters. You see the two ureters here. So that means you are looking at the ureters and the two kidneys here. See the kidneys. So all these structures which I am showing you in this diagram, these are all extraperitoneal, I say retroperitoneal structures. You see that this is called the kidneys. On the top of the kidneys, we have got suprarenal gland. And you see emerging from the hilum of the kidney is the ureter. And you are watching not only this, but at the same time in the posterior abdominal wall, if you are seeing in the retroperitoneum, here is aorta. And on the right side, it is the inferior vena cava. On the other side is the kidney also. Suprarenal gland. And see ureter. And when you are coming down here, you see the all these structures, the ureter, and you are looking all these structures, they are actually going into the pelvis here. These are pelvic structures. We will discuss them in the pelvis. But here, these are all retroperitoneal in this region. That means we have removed peritoneal cavity. I say removed peritoneal cavity, the peritoneal viscera, etc., everything. And now actually remove the parietal peritoneum to enter now into your posterior abdominal wall. So means 9th layer of your posterior abdominal wall has been removed. And you are in the 8th layer, that is called the retroperitoneum. In the retroperitoneum, there are a lot of structures you are seeing here. Inferior vena cava, aorta, pair of kidneys, pair of suprarenal glands, pair of ureters, all these things. But you see that if you are saying these structures are there, okay, we agree. But problem is there, why the cecum, ascending colon, not the transverse, descending colon, even the duodenum, most of the part, and even the pancreas also, which were in fact the part of the gastrointestinal tract. Why they are present in the retroperitoneum? They are very much intraperitoneal. And you have seen these all were actually intraperitoneal suspended within the mesentery. Why they are present? We will discuss them when we will come into the peritoneal cavity. We will tell you that these structures, they were in fact intraperitoneal in the beginning in embryological setup, but they have become secondary retroperitoneal organs. So they will be in fact sleeping upon, as a sleeping anteretro, and they are hiding the already originally occupying, say, already originally situated retroperitoneal organs. Primary retroperitoneal organs, they will be hidden partially by secondary retroperitoneal organs. So you are you see many parts of your gastrointestinal tract. If you see starting from your esophagus, no. Stomach, no also. Duodenum, some portion, it is totally intraperitoneal, but the rest of all duodenum, almost it is extraperitoneal, I say retroperitoneal, has become retroperitoneal. That's why it is present in this diagram. So it is present in the retroperitoneum. And when you have removed this retroperitoneum, you see after that, jejunum, ileum, etc., everything is intraperitoneal. But you see here the cecum, ascending colon, all they are retroperitoneal, but the transverse colon is not. And descending colon is yes. And sigmoid colon we can't see here. And if you are actually looking at this and you see this aorta dividing into the two common iliacs, and you see this. But these are all things we will actually discuss one by one. So in the in this area, in the retroperitoneal, when you enter into the retroperitoneum, you have to discuss here the kidney, suprarenal glands, ureter, and then aorta, inferior vena cava. At the same time, some lymph nodes, important lumbar lymph nodes, and then autonomic nerves also. And at the same time, you see lumbar plexus as well. These structures we will discuss in the posterior abdominal wall. In the retroperitoneum, most of them, they are in the retroperitoneum. So you are looking at this structure. And when you are actually removing all these retroperitoneal structures, so cleaning them total, you will actually see clean posterior abdominal wall. What you have removed, actually what you will remove now, you will remove now. You see, from inside, ninth layer, eighth layer you remove, means the extraperitoneal fat you remove. And along with that, all viscera will come and they will be removed also. Fascia, that is called the fascia transversalis, whose equivalent here are analogous. You see that will be the source fascia, remove that. Now you will see three layers of the muscles, just like in the anterior abdominal wall. And here centrally on either side of your midline, and here on the either side of midlines on the both sides of your spines of your vertebrae, erectorospinae muscle. So here you will see this, and on the sides you have got three muscles each in layers again till you reach the three layers of the skin and the fascia. So you are actually going in this, and if you remove all this, you will reach this, and you will see what you will actually be watching here in the posterior abdominal wall after you have removed all these structures, which I'm actually showing you here. But before you will actually remove all, you have to discuss all these structures. This will be our third session when we will discuss this. So in the beginning, anterior abdominal wall, then later on, abdominal cavity, then posterior abdominal wall. So it will be actually three steps in which the abdomen will be discussed. And the anterior abdominal wall, I told you that you have to discuss the anterior abdominal wall, how it is formed, what are the muscles, where the origin section of these muscles is, and due to the composition of this interior three layers of the muscles, there will be one important structure here that is called the cleft, or the space between the muscles, that is called the inguinal ligament, and if, sorry, inguinal canal. And if the inguinal canal is there, then inguinal hernia is important in this. Rectus sheath, the rectus abdominis is supporting your central portion of your anterior abdominal wall, so it will be ensheathed in the aponeurosis of these three muscles which are there. So it's called the rectus sheath, and rectus sheath has also some important clinical relevance here. And at the same time, scrotum also, anterior abdominal wall extension here, and some more things you will see in the anterior abdominal wall. And then you will open it, you will enter into the abdominal cavity where you will see the gastrointestinal tract, along with the hepatobiliary tract also, including pancreas and spleen as well. And after you have done all abdominal cavity, then you will come to the retroperitoneum, posterior abdominal wall. First of all, it will viscera, which I have shown you here. All these viscera you will discuss. And when you have discussed all these viscera, now the wall you will discuss, because you are going from anterior to the posterior side. So wall means these three muscles again, and many other things also. Watch in the next diagram which muscles you are going to discuss as far as your posterior abdominal wall is concerned. It's not as important as your anterior abdominal wall, but it is surely important. You have to actually see here, because in this in the posterior abdominal wall, embedded between the muscles, in fact, will be your spinal nerves, like lumbar plexus. At the same time, vertebral column, lumbar vertebrae has to be done, because vertebral column was not present anteriorly, so we didn't actually do any bone in the anterior abdominal wall. But posterior abdominal wall, you will see that we have 5 lumbar vertebrae, but we will discuss at least one typical lumbar vertebra. Means in the abdomen, you have just one simple typical lumbar vertebra that you have to discuss. Almost boneless region, you can say. But you have got just one lumbar vertebra that you have to discuss in the abdomen. Come and see the last diagram of your abdomen, how posterior abdominal wall muscles actually look like.